Welcome back, viewers. In today's video, we are going to discuss about the osteology of humerus. Okay. The humerus is the bone of the arm. Humerus is the bone of the arm, and it is the longest bone of your upper limb. If you consider all the bones of the upper limb, this is the longest bone of the upper limb. Now, how did it get its name as humerus? It has got a small groove in the posterior surface in the lower end through which the ulnar nerve will pass through. So, whenever this ulnar nerve is stimulated, it will give a tingling sensation, a funny sensation. So, that is how it has got its name as humerus, or otherwise it is sometimes referred to as the funny bone, the sensation. Suppose if I am resting my hand like this on the table, the ulnar nerve, it can get compressed here near the medial end, and it will give rise to a tingling sensation, which by which it has got its name as humerus. Coming to its presenting parts, it has got an upper end, it has got the lower end, and it has got a shaft, just like the long bones, upper end, lower end, and the shaft. Okay. Now coming to the features, what are all the features in the upper end, lower end, and the shaft? So this is the upper end of the humerus. This is the upper end of the humerus. This is the shaft of the humerus, and this is the lower end of the humerus. The upper end of the humerus, shaft, and lower end. First we'll discuss the upper end. This is the upper end of humerus. The upper end of humerus, it has got a head. You see, it has got a rounded head. Now this articulate with the glenoid cavity of the scapula to form the shoulder joint. Okay. So the parts in the upper end, it has got a head, it has got a tubercle, it has got two tubercles. This one is the greater tubercle and this one is the lesser tubercle. Greater tubercle and lesser tubercle, and it has got a neck. So the parts of the upper end are head, two tubercles. This is the lesser tubercle and this is the greater tubercle, and this groove between the two tubercles, this one, it is called as intertubercular sulcus, or it is also referred to as bicipital groove, and it has got a neck. There are two different types of necks. One is anatomical neck and another one is the surgical neck. So those are the parts in the upper end. So as I told you, the head, it will articulate with the glenoid cavity to form the shoulder joint. Next we will discuss about the tubercles. So this projection which you are seeing is the lesser tubercle of humerus. See this one, lesser tubercle. So this is a smooth muscular projection. This is formed by the insertion of subscapularis muscle. Okay. So this gives insertion to the subscapularis muscle. Next, this is the greater tubercle. Now, if you have a look at this greater tubercle, it will have three flat impressions. 1, 2, and 3. Okay. So the highest impression on the greater tubercle is for the insertion of supraspinatus muscle. Middle impression is for the infraspinatus muscle, and this lowermost impression is for the teres minor muscle. Okay. So sit muscles, S-I-T, sit muscles, you remember them like that, sit muscles. Okay. So the greater tubercle is giving insertion to the sit muscles, supraspinatus, infraspinatus, and teres minor, and the lesser tubercle is giving insertion to the subscapularis muscle. Together they are referred to as sit-S muscles. Sit-S muscles, and these muscles, they form the rotator cuff in order to provide stability to the shoulder joint. Next, you have got this groove which we are calling as the intertubercular sulcus or the bicipital groove, because the tendon of biceps, the tendinous origin of biceps will pass through this groove. Okay, so that is why we are calling it as the bicipital groove. Next, the other parts of the upper end. The upper end, it has got two necks, I told you. One is the anatomical neck. Anatomical neck is the immediate constriction below the head. Immediate constriction below the head. You are able to see this constriction, that is called as anatomical neck. And the place where the upper end will meet the shaft, where the upper end is meeting the shaft, is called as surgical neck. This is the surgical neck. Okay, so up to this level is the upper end. So this is meeting the shaft here. So this is what we are calling as the surgical neck of the humerus. So the axillary nerve is related to this surgical neck of humerus. So if there is a fracture of the surgical neck, the axillary nerve can get damaged. Okay, so that is about the upper end. Next, moving on, we will have a look at the shaft of the humerus. So this is the shaft of the humerus. Okay, so the shaft, it has got three borders and three surfaces. So beginning from the greater tubercle, you have got the anterior border. Okay, this is the anterior border. Next, beginning from the lesser tubercle, you have got the medial border. This is the medial border. You see, this medial border is becoming prominent in its lower part. It is forming the medial supracondylar ridge. This is the anterior border, and this is the medial border. Okay, next, this is the lateral border. The lateral border is forming the lateral supracondylar ridge in its lower part, and in between it becomes indistinct, and again posteriorly it becomes visible, and it becomes continuous with the posterior part of the greater trochanter, greater tubercle. Okay, so we have seen three borders. One is the anterior border, medial border, and lateral border. So we have got three surfaces. So if you see the shaft, it is rounded in its upper part and it is triangular in its lower part. It is rounded in its upper part and it is almost triangular in its lower part. It is changing its shape. Now the three surfaces in between these three borders are, in between the anterior border and the medial border, we have got the anteromedial surface. In between the anterior border and the lateral border, we have got the anterolateral surface. So this is the anterolateral surface. This is the anteromedial surface. And in between the medial and lateral borders, we have got the posterior surface. So three surfaces. One is anteromedial surface, anterolateral surface, and posterior surface. Now we'll have a look at the attachments on each surface. So initially we will discuss anteromedial surface. Okay. So in between the anterior border and the medial border, we are having the anteromedial surface. Okay. So in this anteromedial surface, you can make out, you can see carefully, this bicipital groove which we were talking about, it is extending. Okay. So this is called as intertubercular sulcus. sulcus. Now it has got two lips. This is a lateral lip. This is the medial lip, and in between is the floor of the intertubercular sulcus. It has got a medial lip, it has got a floor, and it has got a lateral lip. This lateral lip will give insertion to pectoralis major, and this floor will give insertion to latissimus dorsi, and the medial lip will give insertion to teres major. How will you remember this? You remember it like lady between two majors. Lady is latissimus dorsi, and the two majors are pectoralis major and pectoralis minor. Okay, I repeat, lateral lip gives insertion to pectoralis major, medial lip insertion to teres major, and in the floor it will give insertion to latissimus dorsi. So this is called as, commonly remembered as lady between two majors. Lady between two majors. So that is about the anteromedial surface in its upper part. And in the middle of the anteromedial surface, you can see one rough impression. So this is for the insertion of coracobrachialis muscle. Now, as you go further down, the anteromedial and anterolateral surfaces. So this is the anteromedial and this is the anterolateral. So these two surfaces in the lower half, they give origin to brachialis muscle. So what did we see in the anteromedial surface? We have seen the insertion of lady between two majors. We have seen the insertion of coracobrachialis, and lower down the origin of brachialis muscle. And the nutrient foramen is present in the anteromedian surface. See, this is the nutrient foramen which is present in the anteromedian surface, okay, in the middle of the shaft of the humerus. Okay, that is about the anteromedian surface. Now we'll discuss about the anterolateral surface. So the anterolateral surface is present between the anterior border and the lateral border. So if you see carefully, the anterolateral surface, it has got a V-shaped deltoid tuberosity. V-shaped, you are able to see a V-shaped deltoid tuberosity. So this V-shaped deltoid tuberosity will give insertion to the deltoid muscle. Okay, so that is the feature in the anterolateral surface in the upper part. As I told you previously, the anterolateral surface in the lower part, it will give origin to brachialis muscle. So anteromedial and anterolateral in the lower part will give origin to brachialis muscle. Okay. So in the anterolateral surface, we have seen the insertion of deltoid muscle in the deltoid tuberosity, and lower down it gives origin to brachialis muscle. Next, the posterior surface. The posterior surface, it is marked by a presence of a groove. See, this groove. You are able to make it out, a groove. This is what we are calling as the spiral groove. This spiral groove is limited above by one oblique ridge. So this spiral groove which is there, you are able to make it out, this one. Okay, this spiral groove, it will give passage to the radial nerve and the profunda brachii vessels. So you have seen one oblique ridge above the spiral groove. This will give origin to the lateral head of triceps. And the part of the posterior surface which is smooth below this oblique ridge, below the spiral groove, this will give origin to the medial head of triceps. triceps. So in the posterior surface we have seen the spiral groove and the oblique ridge which is giving origin to the lateral head of triceps, and the smooth surface below the spiral groove giving origin to the medial head of triceps. Okay, so that is about the posterior surface. Next, moving on, we'll discuss about the lower end of humerus. So this is the lower end of humerus. So this lower end of humerus, it has got articular parts and non-articular parts. Articular parts are the ones which will articulate with other bones to form the joints, and the ones which do not take part in the formation of the joints are what we are referring to as the non-articular parts. So the articular parts are this rounded one, ball like one is called as capitulum, okay, which is present laterally, that is towards the lateral aspect, and medially you have got one pulley shaped structure which is called as trochlea. So trochlea and capitulum will form the articular parts of the lower end. Trochlea will articulate with trochlear notch of ulna, and capitulum will articulate with the head of radius in order to form the elbow joint. Now just above the trochlea, so these are the only articular parts. Coming to the non-articular parts. In the non-articular parts, we have got 3 fossa and 2 epicondyles. Okay. So lower end, if you see, it is expanded transversely. So the non-articular parts are these 2 fossae. There are 3 fossae. So one above the trochlea, which is called as coronoid fossa, and one above the capitulum, this is called as radial fossa, and one fossa which is big and present posteriorly is the olecranon fossa. Okay, 3 fossae: coronoid fossa, radial fossa, and olecranon fossa, and 2 epicondyles: medial epicondyle, this projection, medial epicondyle, and lateral epicondyle. Medial epicondyle and lateral epicondyle. Okay, and articular parts, as I told you, is capitulum and trochlea. So what is the function of these fossae? So this coronoid fossa, which is present above the trochlea, it will lodge the coronoid process of ulna in complete flexion. When you completely flex your hand like this, the coronoid process of ulna will come into contact with this coronoid fossa, and this radial fossa, the head of the radius, will come into contact with this radial fossa in complete flexion. Now what about this olecranon fossa? In complete extension of your hand, the olecranon process of the ulna will reach this olecranon fossa. It will occupy this olecranon fossa. Next, the 2 epicondyles. You have got a medial epicondyle and you have got a lateral epicondyle. The medial epicondyle is more prominent when compared to the lateral epicondyle. So this medial epicondyle, it will give attachment to the ulnar collateral ligament, and in the posterior part of the medial epicondyle, you have got a groove. This groove is for the passage of the ulnar nerve. It allows for the passage of the ulnar nerve. And this is the lateral epicondyle. This lateral epicondyle, it gives attachment to the radial collateral ligament, and posterior surface of this lateral epicondyle will give origin to anconeus muscle. And other important thing is this medial epicondyle, which is there, it will give origin to all the superficial muscles of the forearm, front of forearm. So it is called as common flexor origin. So this lateral epicondyle which is there, it will give origin to all the extensor muscles of the forearm, that is the back of the forearm. So it is called as common extensor origin. Common extensor origin. Okay, so in the shaft actually, these two ridges which are there, the medial supracondylar ridge and lateral supracondylar ridge, these will give attachment to the medial and lateral intermuscular septum. Medial and lateral intermuscular septum, and the medial supracondylar ridge in its lower part will give origin to the pronator teres, humeral head of pronator teres, which is a muscle of the anterior compartment of forearm. And this lateral supracondylar ridge, if you see, it forms a flattened sheath in the anterior aspect. Okay, it forms a flat sheath. Okay. So this part, in the upper 2/3 it will give origin to brachioradialis, and lower 1/3 it will give origin to extensor carpi radialis longus muscle. So these two are the muscles of the posterior compartment of the forearm. Okay, so because I just wanted to mention all the muscles of the forearm, I didn't mention this part in the shaft. I am mentioning it now. Okay, so that is about the humerus and total. And coming to the specialties of this humerus, I told you why humerus is actually called as humerus. So I told you why it is actually called as humerus, and other specialties is, if you look carefully, the upper part of the humerus will receive only insertions only, except the lateral head of triceps, and the lower part of the humerus, it is giving all origins. So mostly we are talking about, and then this humerus which is there, it is related to three important nerves. It is related to the axillary nerve at the surgical neck, and it is related to the radial nerve in the radial tuberosity or the spiral groove, and it is related to the ulnar nerve here behind the medial epicondyle. So it is related to three important nerves. So this, whenever you fall on an outstretched hand, fracture of humerus can occur. What are the common sites for fracture? One is at the surgical neck, other is middle of the shaft, and other one is supracondylar fracture. Three areas. One is at the surgical neck, one is at the middle of the shaft, and another one is the supracondylar area. So three areas where fracture can occur. So with all this knowledge, we will try to determine the side of the humerus which is there in my hand. So what we will actually do is, we will put the head facing medially, and we will put the lesser tubercle facing anteriorly, and in the lower end you see the olecranon fossa. The big olecranon fossa which is there, it should be facing posteriorly, and capitulum and trochlea should be facing anteriorly, and the medial epicondyle, which is more prominent, facing medially, of course. So by that we will determine the side of the humerus. Okay, so we are putting the head facing medially, we are putting the lesser tubercle facing anteriorly, and we are putting the olecranon fossa facing posteriorly. So by that we determine that this is a right side humerus. So these are the points for you to determine the side of the humerus. Okay, and coming to its ossification, this humerus, it is ossified from one primary center and 7 secondary centers. Okay, the primary center will appear at 8th week of intrauterine life, and the remaining 7 secondary centers which are there, 3 are for the upper end and 4 are for the lower end. Okay, so that is about the ossification of humerus. So with this, we come to an end of this session on osteology of humerus. Thank you for watching.